Good evening, everyone. Welcome. I am Dr. Daniela Steyn, and I'm so grateful that you're going to spend your evening with us. I want to start by saying that I know that you're busy. Each one of you who's registered on this list have full lives, and I recognize that. You're a mom, you have a full-time job, you have children to look after, aging parents. You have a lot on your plate. I've never met a woman going through menopause, perimenopause, who does not have a full plate. We're in the busiest, fullest phase of our lives. And I recognize that, and I really appreciate that you're here tonight, spending time with us. I guarantee that we're going to make this worth your while. So sit back, relax. We have a packed evening for you. Whether you're in perimenopause, menopause, postmenopause, here to focus on longevity, we have expert speakers that will talk to you tonight and give you something that's really my heart's desire, that each one of you will get something from tonight, something that you can implement into your life right away, that will elevate your health, that will take your life to the next level. It's really an exceptional panel of people that will be talking tonight, exceptional panel of presenters. And everything that patients come to us, how do I manage hot flashes without hormones? Should I go on hormones? What do I do for my menopause, for my libido? What do I do for weight gain? What do I do for brain fog? We'll answer these questions for you tonight. It's very comprehensive what we're going to cover tonight. I know that you will enjoy it, and thank you so much for spending time with us. I'm Dr. Daniela Steyn. I'm the founder of Wellness MD. So Wellness MD is really founded to help people live their best life. I'm double board certified in lifestyle medicine. That is where we look at all the research of things that we can do that's outside of medicine with research behind it to help you live stronger, live longer. It looks at how you sleep, how to optimize your sleep, and the research behind good quality sleep, how it improves longevity, quality of life, help with weight management. And I know that's why many people often come to us here at our wellness clinic, is to help optimize their sleep, and we'll touch on that tonight. Another pillar of health is our movement, how we move our bodies and how that looks different during perimenopause, menopause, and after. A big pillar is nutrition. Everything that we eat, how it becomes part of our bodies, how it makes us stronger, more resilient. Our rest, our relaxation, our communities that we spend our time with. These are all the pillars of lifestyle medicine that we incorporated our lifestyle medicine clinic to really help people live their best life. The people who will be talking to you tonight are very intentional. I want you to not just listen passively tonight, but to really lean in, take notes, use the chat, and we'll reply to all your questions. If it's a more personal question and you want to email that or send a private message, there's an option for that too. So ask questions, use the chat, because the women who get most, I find women who get most out of these events are the women who really engage fully, who get their questions answered. We want to answer your questions. I really encourage you to stay with us to the end. I'll be giving the last talk. And my goal for you is really simple, that you can feel informed, that you feel empowered, that you can be hopeful, because menopause is really a new beginning for you. It's an incredible opportunity where your brain is literally rewiring itself. It is the beginning of a new powerful chapter. And if you have the right tools and the right support, it can really help you, enable you to have a stronger second half of your life. So sit back, relax. I'll start by briefly introducing everyone that will be talking tonight. So at our clinic, we do prescribe hormones. And I'll maybe start with saying, when do we give hormones? When do we not give hormones? But there are many women who choose to not have hormones. And that's really what my book is about. Now, menopause, people are more open to the idea of hormones. And there's a lot of research coming out showing the benefits to protect heart health, to protect brain health, to prevent many illnesses and help people live longer, stronger. So from a longevity perspective, a lot of people come for hormones now. But before this was as widely known, really since I was in practice from 2006, to graduated 2006, from 2007 in practice, women would come to me and say they're going through menopause. They have these symptoms. They just do not want to be on hormones. And that's really what my book is all about. My book, and I know most of you have read this book, Thrive Through Menopause. It is very easily available on Amazon. But the book goes through everything outside of hormones that you can do that address all the different symptoms of menopause. And that is why a lot of our clients do come here. And that's what Lorena is going to be speaking today on the role of acupuncture. And that is one of the many tools in your toolbox. And there are so many other things, but that's one of the things that women can use through menopause. And it's been fascinating, the success we've had at our clinic on how, and I think you're going to find it very interesting if it's new to you, if hormones or hot flashes is your biggest concern, what you can do to help you restore balance. And the other things we give for hot flashes as well, I covered in my book. There's other medications, there's other natural strategies. So Lorena will chat with you on acupuncture. We have Bonnie Flemington. She has a wealth of experience specifically regarding belly fat and nutrition and menopause. That is a big reason why a lot of women come to us where they would say they're working very hard, they're doing everything right, but they notice an increase in belly fat around their abdomen. And this is quite big, right? Because if you I find a lot of women who come here just start calorie restrict, and actually becoming malnourished. And because they're malnourished, they now have other symptoms, brain fog, decrease in muscle mass. So that's a very valuable talk. We have 100% success helping people gain weight, lose weight, lose fat, and gain muscle mass. We have a body composition analysis machine to look at your body, because if we have twins standing next to each other, the one might have more muscle and the other one more fat. So even though they look identical on the outside, the person with more muscle will have a faster metabolism, won't gain weight during menopause. The one with very little muscle and more fat, even though they're at a low weight, will have a slower metabolism, will gain more weight during menopause. So Bonnie is really good. She'll explain to you nutrition strategies, how to lose weight during menopause, and specifically abdominal fat. Then a big one is a lot of women come to me for testosterone to increase their libido during perimenopause, postmenopause. There's a lot of things we can do to improve our intimate life. You can have incredible intimacy after menopause. It looks very different than it looked before. There are different things that you will find enjoyable. We look at how to improve blood flow towards female genital areas to make it more enjoyable. But you can have an amazing, amazing intimate life in your perimenopausal years, postmenopausal, and we'll touch on those things. We have a couple of blogs to read as well on my website on improving blood flow to the vaginal area, vaginal estrogen. There's absolutely no contraindication to that. Even for women with estrogen positive breast cancer are still allowed to use vaginal estrogen or vaginal DHEA. We really explain everything in detail. But then a lot of women who come to me for testosterone, or the other one, we call it scream cream, something it's similar to Viagra for men. We have it for women. But then as I start talking to women, I realize that it's not necessarily a hormone deficiency they have, but what they might be encountering is relationship difficulties. So we have a marriage counselor. That's actually the first person. We have two marriage counselors. or relationship counselors here at our clinic, but Erika, our marriage counselor, was the first person that I asked to join me here at Wellness MD. And it can make a significant difference to your intimate life, to your quality of life, to your relationship, if you can really strengthen your communication in midlife. It's devastating the amount of people who actually go through divorce or have estranged relationships. And that is something that you can turn around. So thanks to Erika, who's joining us tonight, specifically discussing relationships and communication in midlife. Then still on the weight issue, that's really a lot of women come to me and they say, should I use Ozempic, Mounjaro? What do you think about that? So we have a big program. We've worked with so many women specifically regarding weight loss. And I'll ask Jessica to talk to you about that. Jessica is a registered nurse with more training in coaching and functional medicine. And we are currently running a very successful program where we do prescribe Ozempic or Mounjaro to those people. Some want it, some don't. I do prescribe if people want it, but only in combination with this program. And these are things that you can do tonight. So listen to that. You can start doing it right at home. And she really explains why it's not really a motivation issue or a self-control issue, why people have a hard time losing weight, but what you can do to increase your muscle mass, decrease weight. And if you do choose to go on a GLP-1 inhibitor medication, the specific strategies we put in place so that you can again then go off it 3 or 6 months later and when you get to your goal weight, and you don't have to stay on that, which is quite important. And then a lot of women come to me to just optimize their quality of life, and they say, I'm doing everything right. I'm looking at my sleep, looking at my nutrition, looking at my movement, looking at what's filling my life, and I need a bit of an energy boost. I now feel young on the inside, but on the outside, I notice aging, So that is from that, what we actually developed at our clinic is I ask people who are specialists in their field and skin and to join us. So Marnie will talk about 2 of those things. The one is IV vitamin therapy. A lot of women do come to us for that. And she'll explain, if you're interested in it, how it works, what's the benefit. And she'll talk a little bit about the changes that you can notice in your skin, which are preventable and which are not preventable. Then Dr. Julia Fountain is incredible. She has a wealth of menopause experience. She's a naturopathic doctor. She is obtained the same certification as medical doctors. All our naturopathic doctors that get the same certification as medical doctors get when they do further training in menopause through the North American Menopause Society. So they're able to prescribe hormones. We, at our clinic, is a multidisciplinary clinic, so we work in collaboration. So when you do get care here, the care is can be both from a medical doctor, naturopathic doctor, psychotherapist, nutritionist, everyone who provide care at this clinic. And Dr. Fountain will specifically talk on libido tonight. She will explain how low libido is more common in midlife and to understand what you can do about it. As I said, testosterone do help a lot of women, but I find that it's only 15% of the solution would be testosterone or estrogen or progesterone. And Dr. Fountain, our naturopathic doctor, will really talk to you about that, explaining to you things that you can do to optimize your libido. And that can really be a very rewarding part of your life. There are other things. People come to me. They would say, now I feel great. I've gone through your program, looking at my nutrition, optimizing my hormones, sleeping great, but I notice stretch marks or things like that. That's now bothersome to me. And Garnel will talk to that, strategies you can do to help you feel more comfortable in your body. Steph is going to talk to us tonight specifically regarding relationships, things that you can, from a mind perspective, and I'll really talk about that at the end as well, is about your brain. You're at an incredible phase where your brain is rewiring itself. So you're now in the middle of your life, and for the next half of your life, you have a lot of control. We call it neuroplasticity of the brain's ability to regenerate, adapt, and I'll save that for the end. So first, to start of our evening, what is menopause? Menopause is when a woman has a menstrual cycle to help her increase her or to enable a woman to have babies. A woman will have a menstrual period, most women, every month. This will happen when she goes through puberty, will have a monthly cycle. That cycle is controlled by the ovaries that help you ovulate and secrete several hormones to enable you to have a monthly menstrual cycle. Menopause, what the word means, meno is menstruation, and pause it means it stops. So menopause indicates to us when your menstruation has stopped, saying that after this, you won't be able to have babies anymore. However, during that menopause transition, your period will become irregular. You might skip 6 periods and then have 2 periods, and then skip several periods and have periods. And this can continue for a long time. So a long time ago already, as doctors, we decided the definition will be that menopause would be when you have not had a period for 12 months. So that's actually just one day in time when you say you're now in menopause. The 10 years before that, when your hormones start decreasing, would be called your perimenopausal years. And then after that one day in time, you will be postmenopausal. So if you're going to live till you're 104 and you go through menopause, like the average Canadian go through menopause at 51, that means you're going to spend the second half in your life postmenopausal. And it is quite critical that we optimize your health, optimize your brain health, optimize your cardiac health, optimize your muscle health, as your muscle mass is really the strongest predictor of mortality, of how long you're going to live and how strong you're going to live. Okay, so to get back, most women, your median age for a Canadian woman would be, for menopause, would be the age of 51 years. So the women, that's just the median. Then some women go through menopause from 40, some from up to 60. So that's for the average. We always have outliers. Some of our patients go through menopause already at 28, 34. It can happen sooner, it can happen later. Average would be 50. If your last period is when you're 51 years old, you will start having a decrease in estrogen, decrease in progesterone the 10 years before that, and it will fluctuate. That is when women come to our clinic and they tell me that I don't recognize myself anymore. And when we ask, do you think you could be perimenopausal? Women would often say, oh no, I still have my period every month. So I want to explain to you, even if you do have your period every month, you could be perimenopausal, a decline in estrogen, progesterone, testosterone. And if you are interested in hormone therapy, you can start hormone therapy while you're still having periods when you're perimenopausal, or you can start looking at one of the many other strategies we have to offer to optimize your health and to protect you. Okay, so the first one is women would come to me and they would say, I'm not having hot flashes, I'm not having night sweats, because this typically only happen at the end of menopause, right? So the 10 years before that, they would ask, am I perimenopausal? How do I know that I'm perimenopausal? So in my experience working with women over the past 20 years who are perimenopausal, postmenopausal, the most common thing to symptoms that you can track would be brain fog, where women would say they don't know what's happening, but they have limited concentration. They're not able to remember things as well. They might have mood shifts. They might have sleep disturbances, being awake 3 o'clock in the morning. Abdominal weight gain might be something they come with. Um, Acne, dry skin, and that's really why we started the dermesthetic skincare line. And that's a whole new topic for a different day. Let me grab one of these products. So we found the need, a lot of our patients, and we actually developed a skincare line. But tonight we have so many topics to cover, so I won't talk on that. But that is why, because a lot of women came to me in the perimenopausal years with skin changes, maybe acne, maybe dry skin, hair loss. And we have a lot of things to offer for hair loss. We'll maybe put links for talks on hair loss and what you can do for hair loss. That's very common in perimenopausal symptoms. Then irritability and joint pain. Oh, that is a big reason why our rheumatologists refer patients to me, is specifically for joint pain, for frozen shoulder. It would be women who would have been very well controlled on their autoimmune disease medication. And then suddenly, as they go through the perimenopausal years, it's really just as if they're falling off a cliff. If we do give estrogen, then frozen shoulder goes away, joint pain goes away. Okay. So those are often the first things women notice. Patients come to me and they ask, should I do blood work for hormone therapy or to test if I'm in menopause? So our test, according to the Canadian Menopause Society, is if a woman comes and she has hot flushes, menopause symptoms, we can give hormone treatment. We don't have to test her blood work, her hormone levels to determine what dosage of hormone therapy she's going to get. That does not mean that you should not get blood work. You should get a lot of blood work. We have to test your heart health, your cholesterol, screen for diabetes. There's a lot of tests that we have to do. We have to screen for breast cancer, for bone density. So we do a lot of testing. But to be able to get hormone therapy, we titrate your hormone therapy according to symptoms and to best practices to prevent illness, dementia, and muscle loss, osteoporosis. So we have very thorough guidelines to work towards when we do prescribe hormones. We don't have to treat according to blood work. It does not mean you can't have blood work. Places where blood work is very, very helpful would be in your perimenopausal years, where you are still having a period every month. Once off blood work is not helpful. We typically do it on day 21 of your cycle. You might need 2 to 3 times to do this blood work over a period of 6 months, and then twice a year to follow your trajectory. A lot of women in these years also ask for Dutch testing. Dutch stands for dried urine test of cortisol and hormones to really assess your adrenal hormones and your estrogen metabolism in addition to your blood levels. This is also very helpful because your hormone trajectory, we need to know the whole story, not just a once-off snapshot. And then I find with a lot of patients, when I investigate them so thoroughly, they have other things, their thyroid function, other hormones, thyroid function, adrenal dysregulation, blood sugar instability, metabolic syndrome, gut microbiome imbalance. That's big. And Bonnie will be talking about nutrition. But for some people, then we have to do a gut health test for their microbiome. And then their answer is to increase the gut microbiome and not to give hormones. So every person is so different, right? And then nutrient deficiencies is so common. That's why we started giving IV vitamin therapy at this clinic. And we test for it and we treat. And then Marnie will talk about IV therapy and why we're offering it and why it's helpful. Then we really optimize the foundations before we give hormones. And even if we do give hormones, we always have to optimize our foundations. Women who do the best, who really thrive, are the women where these foundations are really optimized. We look at sleep. We look at a consistent wake time, 7 days a week to regulate your rhythm. We look at good quality sleep, not just the hours spent in bed, but good quality sleep. We do look at your gut health, if you need probiotics, sometimes this gut testing, well, always, if you're interested to know, gut testing can tell you which probiotics to use. A common one, if you just want to pick one tomorrow, would be a lactobacillus strain, um, because your microbiome directly affects your estrogen metabolism. Your protein intake is critical. So we, at our clinic, everyone who comes in get a body composition analysis. If you Google it, you'll see there's a lot of research showing that your muscle mass is very directly correlated to your metabolism, your longevity, how long you're going to live, how strong you're going to live. If you're watching this today and you don't have access to a body composition analysis, knowing what your muscle mass is, for a rule of thumb, start by increasing your protein to about 25 to 35 grams per meal, especially breakfast. It helps to stabilize your blood sugar, improves your metabolism. It reduces mood crashes. Quite often when women come to me saying, I'm irritable, I'm anxious, I'm depressed, we really look at their nutrition. What you ate yesterday, what you ate the day before impacts your blood sugar levels, and it impacts your mood, how you are able to be present for your loved ones, present for yourself. So blood sugar has a very big impact. Some of our clients, we even give a sugar monitor that they put on their on their shoulder just for 10 days or a week, that you just monitor your blood sugar. And for some people will then see, oh, you know what, when I'm so irritable with my husband or my kids, or when everyone annoy me, coincides with the time when my blood sugar drop. Or if you are woken 3 o'clock in the morning, it often coincides when blood sugar drops. So that's very helpful to get to understand your body. But if you're just watching this and you want to start doing something right away, start tomorrow morning with breakfast, protein 3 times a day, about 30 grams, depending if you're average 70 kilogram woman, maybe 35 grams 3 times a day. Next one in the perimenopausal years is to cut inflammation. That is huge. So cut alcohol first. Alcohol is one of our most common toxins that causes inflammation in the women that I see in this clinic. Ultra-processed foods, that would be things that is made in a factory. That's your best return on investment, is if you just start eating whole foods, the way that you can see food on a farm, proper vegetables, things that are not made in a factory, but are the way that they're in a farm. So that's where to start. Then people ask about supplements all the time. My whole book, this book, is full of supplements, things that has evidence behind it. You can easily get it on Amazon. Things that has evidence behind it to whatever symptom you're struggling with. Is it to fasten your metabolism, for focus, for control, for chasteberry is one of the supplements a lot of our patients do well on. Magnesium glycinate, about 200 to 400 at bedtime, help you relax, help you to improve your sleep quality. For everyone here in Canada is vitamin D, 2,000 units a day. So these are easy things that you can implement right away to help you really take your health to the next level in your perimenopausal years. You do not have to suffer alone. You can get support. Make sure you reach out, you get support, you get someone to help you. We are so passionate. We have a lot of resources on our YouTube, on our website. We want to help you, and that is why we're hosting tonight. I'm very excited about this lineup of people. I know you're going to take something home with you tonight that's going to really elevate your health, take your health to the next level. And in the chat, ask if you have any questions. We are here for you. Thank you for joining us. And without further ado, let's start with our lineup.